and you're never going to cure people. You're just going to treat their symptoms in perpetuity. So I'm going to sort of fly through this to give you an overview. What does traditional dermatology do versus what I do? You come in, you have a symptom, you're getting a mold check, they give you a few minutes and they give you some prescription and they say, go with God, basically. And what I'm doing is I'm trying to find out, why do you have this? When you tell me you have symptoms, what do those symptoms mean? For instance, if people tell me they're exhausted in the morning, they're exhausted in the evening, they're cold, they're tired, they're gaining weight, their blood sugar's high, their cholesterol's high, their hair is falling out, I'm looking at why you have this and trying to cure the cause by knowing what that symptom means. So it's all about treating the cause and, most importantly, treating it scientifically correctly. Because in this world today, there's a huge amount of marketing, but scientifically correct is what's imperative, and looking at the body as a whole. Now, the other thing is, in today's world, and being here, and what an excellent weekend has this been with excellent people here. You've got some excellent chiropractors, you've got some excellent acupuncturists, you've got some excellent health counselors, all of which are helping us with the huge amount of stress that people are suffering with nowadays. So we need all the pieces of the puzzle. Again, why I treat the body as a whole, why I deal with all these people as adjunctive people to help me cure you so that you don't suffer forever, and also to slow down the clock, turn back the clock, reverse, and most importantly, prevent. Because from health comes beauty, from health comes greater happiness, from health comes quality longevity. So non-toxic. So many people have stopped by the booth who were suffering with skin conditions that they really didn't need to have. They've seen a lot of practitioners, and people just didn't look at why do they have this and treat it with the best tool for the job. And number one, and also people worry about, and rightly so, pharmaceuticals, and what are the side effects and things that make them suffer more with secondary symptoms. So non-toxic, which means non-inflammatory. Inflammation is the cause of all disease and aging. So you don't want to do anything that is inflaming you more than life is. And what does that look like? What does that start with? Look, part of what we're dealing with is, yes, at some point in men and in women, and increasingly in young women, we're having to deal with bioidentical hormones, but they need to be in mimic nature dosing. And that's only after, do we give people things after we've been unable to cure them because things are so bad internally that we have to bring solutions so they aren't having the side effects that are keeping them from living life healthily and happily. Supplements. People, there's a lot about vitamins. There's a couple of excellent vitamin companies here. I am all in and take a fistful myself every day. It's what keeps your brain good, keeps your bones good, keeps your immune system good. It helps prevent. And so there are things that you need to do that's supplementation, but it has to be done in the correct dose. Supplements are like medications. If you don't give people the right dose, you're not going to cure the infection. If you don't give them the right vitamin D dose, it's not going to help with anti-cancer. So you have to do all the pieces of the puzzle that are required in order for people to get resolution. Now, I'm a formulator. Do I also do skin products that are non-toxic, non-inflammatory? But I'm also a physician, so we do maximal physician strength, because I'm using them to treat skin conditions as well as anything that I do to treat skin conditions is also going to help people cosmetically. It's going to slow down the clock, etc. So one of the words that you've not heard, which you need to know about, is chirally correct, which is chemically correct. which means that every ingredient that's in a product, the body recognizes it. It has the correct chemical structure so that it can go into the body and turn on a good function and not a bad function. That's what makes things work. Medications that are taken off the market are chirally incorrect. Alpha lipoic is a perfect example. Oral lipoic is the chirally correct form. Alpha lipoic, 50% of it, the body doesn't respond negatively to, but it does nothing. So you're wasting 50% of your money. So waste not, want not, and you want to, if you're going to spend your money, spend it wisely, spend it on what works, and know why. Knowledge is power, and you've also got to help take care of yourself in today's world. So ingredients really matter. I teach people that you need to read the ingredients of everything you put in and on your body, because it's going in and it's having an effect. So that's skin products, okay? Chirality, learn that word. It means that things are chemically correct, and that's what makes things work better. Now, on my website, because people are buying all sorts of things, but they need to know the ingredients to avoid, because everything absorbs through your skin. And on this slide are just some of the ones that are inflaming you, that are aging you more, that are increasing pore enlargement, increasing acne, increasing brown spots in skin of every color. So you need to know what not to spend your money on, so your trust is not getting betrayed. And that's a big one in today's world. I talk about inflammation, what it does. And when people have eczema, when they have atopic dermatitis, when they have all sorts of skin conditions that I see, those inflammatory chemicals are what are causing it. And there's certain things that you eat. You are what you eat. Food is your medicine, first and foremost. Number two is we have to exercise. None of us have enough time to do anything, but for our bones, our brain, our immune system, if you're not treating all the pieces of the body's puzzle, no matter what I do, I don't care if I'm the world's best doctor, I don't care if I give you the world's best therapy, it's not going to work, or it's going to work 50%. So when you come to me, I want you to think that I'm a genius and not an idiot. And so that's why I talk to you about internal and external. It's the ingredients, it's the dose, and it's all about doing all the pieces of the puzzle. Now, supplementation. Basically, what I'm doing with supplementation is I am helping, I'm empowering your body, I'm replenishing. I have people come and say, what about the skin? And what I can see, because the skin is a window to what goes on the inside, I can see that internally you're depleted, you're inflamed, you have this or that with your blood sugars high, your cholesterol's high. I can see that by looking at the skin, because the skin is indeed a window to how healthy you are or how unhealthy you are. So there's a reason that we talk to you about glutathione. Is your thyroid good? Is your adrenals good? Are your adrenals good that sit on top of your kidneys? Because those things are depleted in today's world, and it's part of why people don't feel well. Hormones. Hormones are a piece of the puzzle in men and in women, and younger. Look, I see 25-year-old men now who can't get an erection. I see women who have all sorts of period issues or don't have any periods, and that's because their thyroid's low. You've got to know what those symptoms mean. You have to then treat the problem, treat the cause, rather than just giving them things. And you have to replenish the body for anti-aging, for wellness, for health. Wellness is about a lot of different things, including being happy, having a sense of humor, psychologically. Every piece of the puzzle is important. Here's some of the things that we deal with. Alzheimer's prevention. I mean, that's, if you're inflamed, you're increasing your risk of Alzheimer's. You're increasing your risk of acne. You genetically have issues. We have to identify what are your genetics We can't change your genetics, but how do we mitigate them and how do we moderate them? And those are things that we give to you, and we bring in. There's plenty of times I bring in the acupuncturist, the naturopath, the psychologist, the wellness coach to help me make you more well more quickly and try to cure you. This slide is basically about the fact that people are so stressed out in today's world, and if you're stressed, your adrenals that sit on top of your kidneys are depleted, your hair starts to fall out. Number one cause of hair loss is low iron. Number two cause of hair loss is low adrenals. Number three cause of hair loss is low thyroid. If your adrenals are low, your thyroid gets low secondarily. If you don't exercise, your thyroid gets low. Your thyroid's like the battery for your car. Sometimes you can recharge it and sometimes you have to replace it. So we're talking about all those things with you, and thyroid is the gas for your car. But you can see from this slide, if you're exhausted and if you are all stressed out, your thyroid is ultimately going to be low. This is all on my website. Here's some of the symptoms of low thyroid. The symptoms of low adrenals are also on there. The symptoms of low hormones also on there. And here's the things about men. Their hormones go down as well. Progesterone, men get in a bad mood as they go down the path of life. And what a lot of people don't understand is if men's progesterone's low, their prostate enlarges. It increases their risk of prostate cancer. So men go through menopause as well as women do. And this just gives you, look, this is what we deal with when we deal with hormones. And if you're dealing with hormones and they're not looking at all of these hormones, you have to look at DHEA, you have to look at growth hormone, you have to look at dihydrotestosterone. When I'm looking at people with acne, and people have come to the booth who have hair on their face, they have acne, and the problem is genetically, they have high testosterone, they have high dihydrotestosterone. It's just genetics. And if I don't fix that, I'll never cure their acne. So you've got to look at all the pieces, all the different hormone pieces. And if women have low progesterone and they have period issues, it's often because they're so stressed out. I've got to fix their adrenals first. And as I say, you're not smitten by God with low progesterone. It's usually your thyroid's low or you're all stressed out. Your adrenals need to be replenished. Hair loss and iron. People think iron loss just comes from bleeding. If your gut's inflamed, you lose iron through your gut. So yes, we all, if we are good doctors who look at all the pieces of the puzzle, the first thing we're talking about is your gut. You are what you eat. Food is your medicine. And I'm an eat right for your blood type person, but not that anything in medicine is black and white. It's all shades of gray. You have to individualize people, but addressing the gut is critical. And there's a lot of pieces of that puzzle. I have people doing aloe juice. I have people doing glutamine. I have people doing things that are making the cells well. To a certain extent, it's probiotics, but it's not all about probiotics. So hair loss, remember, low adrenals, low iron, low thyroid. I see people all the time. And also people who have a lot of braids in their hair. It's putting traction on those follicles and you lose those follicles forever. And so no matter what we do, it's hard to get them back. So those are, again, all pieces of the hair loss puzzle. So if, in my opinion, in my experience, and I deal with people blessedly around the world, if you're not looking at the body as a whole, if you're not dealing with wellness first, I'm never going to do slow down the clock or dermatologically. Yes, I can take your skin anywhere you want to go cosmetically, but if you're not well, if your gut's not well, if your adrenals aren't good, if your thyroid isn't good, if you aren't at least trying to be happy, then I'm never going to be successful. So we've got to deal, before we bring in, look, everybody who's doing lasers and whatever, fine and dandy. I'm all about the best tool for the job. And so but I've got to make you well first, which is why we care about supplements, gut, happiness, and dealing, finding, identifying why do you have something and trying to cure you, and then we bring in the things. And with with skin products, use things that are the best tool for the job. Otherwise, and there's certain things that really matter. High dose vitamin C, but for supplementation, everybody needs to be on vitamin D. It's anti-cancer to a large extent, first and foremost, or at least it helps with that. Glutathione, vitamin C, anti-inflammatories are very important in today's world. But your gut has to be healthy first and foremost. So, I'm happy to answer any questions. I'm sitting here thinking about, is there anything I've forgotten that you're interested in? I can certainly give you experience with people who've come by the booth, who had, and the weight. Let's just talk about the weight loss thing in today's world. Ozempic is not something that anybody should take. It all came, there's a lot of different ways to cure the metabolic syndrome, which is a huge epidemic in today's world. Number one is you are what you eat. People can't eat bonbons and expect to lose weight and take Ozempic. They need to eat right. They need to exercise, because exercise is going to make their thyroid, their growth hormone, their testosterone, their DHEA all better. And then there are other things that they can do that don't have a downside. I'm increasingly disturbed by, and there are a huge body of lawsuits increasingly. With Ozempic would be the worst one. Mounjaro is a different molecule, but the original molecule is called tirzepatide. But number one is eat right for your blood type, get your gut right, your skin will get better. And does anybody have a question I can answer? What can I answer?
You mentioned about the hair follicles that
with braiding,
come out and
yeah,
they don't come back. I didn't realize that.
Okay, yeah. So what happens with people when, and look, gorgeous. I see them all the time, but what I know is coming to me right in not too many years, because it's the traction on the hair follicle where it's woven in. The hair follicle's deep in your scalp, and at the bottom of it is where the blood supply, the lymphatic drainage, and the nerve come in, and where the stem cells are. So you put that traction on there, it cuts off the blood supply, and ultimately that hair follicle dies. When it's dead, okay? Nothing will make it come back, and there's certain things that we try. We inject CO2, carbon dioxide, into the skin because it helps increase the blood supply, but if it's dead, it's dead. So then what people are doing increasingly now is putting in implants, but those implants have to have a blood supply. And so the blood supply has been decreased to the entire scalp. Again, if you're healthy, you're going to have a better blood supply. Why do we get yellow or brown or with brown spots everywhere as we go down the path of life? Because we lose our blood supply. Exercise helps that. Your gut's got to be healthy, and then you've got to use skin products that really do something, okay? But with the hair follicles, it's a huge issue. Beautiful, but those hair follicles are going. They can't withstand it. And that's why weaves, and also with women, you're better off with tapes because it spreads the pressurization pulling on them.
Thank you for that.
It's a pleasure. Anything else? Al Kirshner, can you tell me what she says? Gut, yeah.
So we talk about inflammation. It's not always serious. Like how do you recognize
Okay, so inflammation on the inside. So number one, gut, okay? What do people get? Look, and the reason I'm an eat right for your blood type person is, for instance, A blood type historically, genetically lacks hydrochloric acid in their stomach. Your stomach's meant to be a vat of hydrochloric acid in order to kill the bacteria, viruses, funguses, parasites that we eat, because food's not sterile. So number one, it's meant to kill that. If you don't have enough hydrochloric acid in your stomach, then they'll feel like their food sits. They get gas, they get bloating, often they get constipation, some people get diarrhea. How do you know if your body's inflamed? Look, your pores get enlarged. If you have the acne gene, it'll set off your acne. If you have the eczema gene, psoriasis gene, it'll make it worse. Brown spots. We age more quickly, okay? And the reason you take antioxidants is I'm putting out the fire of inflammation as much as humanly, scientifically I can, understanding that life leads to death no matter what we do. Inflammation is the cause of all disease and aging. And if you look at people, and they did twin studies on this, a twin that did nothing, another twin who was taking her vitamins, doing the hormones, etc., and she was healthy and doing things that made her healthy. The twin who was doing those things looked 20 years younger, but most importantly, acted 20 years younger. Brain power, etc. So you're inflaming your brain, you're depressing your immune system, and in today's world, we need to be as healthy as we can be. Any other questions? So you want to treat the body as a whole. Thank you very much. I hope that helps.